thanks Amy and Beth and Anna for inviting me. I'm actually really kind of humbled actually to be here with all of you, and very impressed with kind of the work that you're doing. Some of you I know, and some of you don't, so thank you. As I said, Family and Children's Service is a 130-year-old multicultural, multi-service organization dedicated to enhancing the health and well-being of families across the metro area. Last year, I think we served about 25,000 people. And today, though, I wanted to talk specifically around mental health, and I appreciate the words that have been said before. Our mental health programs serve those who are really most vulnerable. About 50% of our families are on very low incomes, with 1 in 4 living at or below the poverty line. 35% are people of color and 13% are immigrants. 1 in 4 of the families that we see for mental health services have no insurance, but most of the rest have insurance and can't afford to pay their co-payments and deductibles. It is not uncommon to hear their struggles about paying for a session, medication, their diabetes, or maybe the groceries. We're able to provide services on a sliding fee scale, which goes down to 0 only because of grants from United Way and Hampton County, and all of which are on the decline. If healthcare were a family, mental health would be a poor relation, even though 1 in 5 kids and 1 in 4 adults experiences a mental health disorder in any given year. And as with medical and dental services, as you've heard, the disparities for people of color and immigrants remain. For example, we see a lot of people who are here because their mental health issues are really born out of trauma from violence. And that may be community violence, maybe violence in the home, and it also is people who are coming from war-torn countries. The other piece, I think, and this was sort of mentioned before, is mental health intervention strategies that I think really effectively connect with communities of color and immigrant communities, and actually even European American communities. The ones that are most effective often don't fit under the medical model. So if you're trying to reach someone in a way that's effective, the less it looks like mental health, which you want to do, the less likely it is to be paid. And last but not least, I want to really reemphasize that thing about the total lack of professionals of color in mental health. And we just, it's very difficult to find professionals of color and people with language and cultural competency. And I just want to give you one example. Carolina is an 8-year-old girl we're seeing at Family and Children's Service. She was raped a number of times by her stepfather. And fortunately, she told her mom, who believed her, and then went through a lot of medical tests and all that kind of thing. Her stepfather ended up in jail, where he still is, thankfully. A nurse suggested that she get therapy, and she came to Family and Children's Service because they had no insurance, and we could see her for free. She's been in therapy for about 2 months, and she suffers from post-traumatic stress syndrome. But she has really made terrific strides in play therapy with her therapist, who is bilingual. She's clearly got a long way to go. 2 months is not a lot of time after an experience like that. But her mother, who works full-time, is really making extraordinary efforts for her to get to every appointment. And I think she's got a great prognosis. Now, not all of our stories are that traumatic or that dramatic, because in fact we hope to get to people as early as possible when there's challenges, which means we need to make our services as accessible as possible. There's a lot of people on this table, and that is in terms of cost, but it's also in terms of connection, place, where we serve. We're in Head Starts. It's a great place to connect with families. Time, obviously, but cultural competency is absolutely essential. And unfortunately, like coverage for medical care and dental care, which I think everybody agrees as early as possible, prevention and shots. Mental health is kind of the reverse, and getting it paid under the current healthcare system early on and doing prevention strategies does not exist, again, because it doesn't look and quite like it does. And that's why Family Insurance Service, our 2009 policy agenda, is really supporting healthcare which increase access to medical, dental, and mental health care for all.
Thank you. You know, Paul, I was just at an event in D.C. For the Sheila Wellstone Institute. Talked a little bit about domestic violence here, and Paul, of course, was a champion of mental health parity treatment. And we really have to make sure that that gets implemented in healthcare reform.
If I can just say, that's absolutely right, and Paul and Jim said, and Kenny, and we supported that. But there is something that people, I think, don't often know about that parity piece, is you have to have parity if you have the coverage, but you don't have to have mental health coverage at all. So if you're a company, you can have medical coverage and then mental health. So that, we would say that is not. So I think that's a real gap.
In reform.
Mental health services will be included in the essential benefits package, and there's been a big push to make sure that that's part of the whole deal. But it's going to be an ongoing discussion and making sure that the payments for those services are equal to physical and surgical benefits.
And I know it's such it is a small piece, but as people have said, it totally connects with medical
It's not so
and all that kind of stuff. And so I really appreciate your willingness to carry that message and hold that mental health care coverage banner up high.
So we have a Vietnamese psychiatrist, Spanish-speaking psychologist, and Russian psychologist in our clinic, so send people our way.
Great.